This is Joan, a patient that presented to my practice not long ago, and she had a little bit of increased adipose tissue around the abdomen, which is inflammatory, and she was struggling from diabetes, and she had rosacea and a little bit of arthritis. She was also hypertensive. She had reflux disease, but she had a tremendously active periodontal disease. Now, because periodontal disease, if you remember in that microbial challenge box, could be generated by yeast, microbes, or viruses. This bacteria chart didn't look overly impressive. However, it still had some pathogens that I would prefer that she not have, and the threshold levels aren't as significant to me. So I told Joan, I think you should go, and I really would be interested in your vascular disease status. Do you know what it is? Joan was 69 years old. She said no, she didn't know. So Joan visited a physician, and I'm not going to, in the interest of time, I can tell you don't need to see the test results. You know what red, yellow, and green means, and so if you see some red, that's probably not good. But more importantly, I wanted to let you know and share with you how Boston Heart has dissected this report into very easy, understandable terms, and how they educate the patients, and how they start to tell patients that vascular disease is a disease of four main entities: lipids, inflammation, metabolics, and genetics. Sounds a little bit familiar to our periodontal disease process. More importantly, look how they educate Joan. And I'm going to just read this brief thing about cholesterol. But in the bottom left it says, Joan, think of it like this. Too much bad cholesterol is like garbage building up in the street blocking traffic. Your good cholesterol acts like strong garbage collectors and large dump trucks that pick up and remove the garbage. Bad cholesterol, keeping the streets clear. This is a great way of explaining this to Joan, because if you look at what I just circled in the middle of your screen, she has a severe dyslipidemia. And so that tells Joan that she has the building blocks of atheroma and that she's in danger and really needs to have that managed. In addition, when you look at her inflammation panel, Joan has inflammatory biomarkers that put her at significant near-term risk that are much, much too high. So if you look at how they communicated with Joan, they basically told her straight out, Joan, if you have a blockage in your artery wall lining, you're at high risk. As a matter of fact, if you don't address the inflammation, you have an increased near-term risk, 1 to 6 months, of a heart attack or a stroke. This is very personalized, relevant information to Joan, and I can tell you she's a changed person as a result of a dentist sending her to a physician. And this is the kind of relationship that I hope we can foster.